Hi, I'm Dwayne Brown. Tonight on KPBS Evening Edition, California's largest hospice care provider files for bankruptcy in a San Diego courthouse. Investigators keep searching for clues in a bus crash on a mountain road. And tonight we've learned the crash took a heavy toll on one San Diego family.
I'm Amitha Sharma. What's next for the Plaza de Panama? A judge said no, and the man backing the renovation plan says it's over. But there's still interest in getting cars out of the heart of Balboa Park. We'll have a look at where it goes from here.
San Diego biotech startups looking for help find an open door in Torrey Pines. And we'll take you into the eye of a media storm where the artist hopes it'll help you and me see the world a little differently. KPBS Evening Edition starts now.
KPBS Evening Edition is made possible by Joan and Irwin Jacobs and by
Hi, good evening. Thanks for joining us. San Diego Hospice has filed for Chapter 11 bankruptcy, the latest in a series of problems for the state's largest hospice care provider. It's been under federal investigation for 2 years, part of a nationwide audit of hospice centers. Medicare has been trying to learn whether the centers are following the rules on patient eligibility. Centers that haven't could have to pay back millions to Medicare. Results of the audit haven't been released yet. Last year, San Diego Hospice began cutbacks, laying off nearly 300 workers, cutting its patient count from 1,000 down to 500 today, and closing its hospital. The hospice says bankruptcy will give them a chance to continue operations while reorganizing, and they say patient care is still their top priority. Now, in the meantime, Scripps Health says it is adding hospice care to its offerings. It's acquired Horizon Hospice, based in Poway. Coming up in a few minutes on Evening Edition, our investigations desk takes a closer look at hospice care in San Diego, asking the question, when does end of life begin? 3 generations of a San Diego family were killed in Sunday's tour, the bus tour crash in San Bernardino Mountains. One of them was a 13-year-old boy. Relatives say he went to Big Bear with his mother and grandmother for a late birthday celebration. 7 people died in the accident. 4 were from Tijuana. Federal and state investigators are searching the wreckage, looking for the cause of the crash. The bus was owned by a San Diego company, and records show it had a history of problems with brake maintenance. The driver says the brakes failed on the way down the mountain. By the way, the investigation could take months. It's over. Those words tonight from the man behind the controversial Plaza de Panama project in Balboa Park, a day after a judge ruled against it. Amitha Sharma talked with project supporter Irwin Jacobs and opponent Bruce Coons of the Save Our Heritage organization.
Bruce, before we get started, I want to play a soundbite from Irwin Jacobs, who spoke to KPBS Midday Edition earlier today about his reaction to the judge's rejection of his Plaza de Panama plan. Let's take a listen.
We tried very hard. The city staff also worked with us very, very well as far as making sure we met all the requirements and that we ended up with a very positive project were it to have gone ahead. At this point, it's over.
So Irwin Jacobs seems to be walking away from this project. What's your response?
Well, obviously we're happy that this project's not going to happen because we think it was one of the worst things that was ever planned for Balboa Park.
Now, his plan, he says, would have removed cars and traffic from the center of Balboa Park. It also would have added a bypass bridge to the Cabrillo Bridge. Why did you oppose that plan?
Because it was introduction of a whole modern service for the car. It was a freeway-like off-ramp that climbed actually around the buildings and went through the Alcazar Garden parking lot, one of the most tranquil areas in Balboa Park, and went into Palm Canyon, into a large structure, moved tons of dirt, tons and concrete. It looked more like something akin to an industrial park in North County.
You called Judge Timothy Taylor's ruling yesterday not just a legal victory, but you said it was a lesson to never allow plutocratic interests to override the wishes of the public. Explain that.
Well, the overwhelming opposition by the public for this project. Everywhere we went, every public meeting, we turned in 10,000 signatures. There were 32 groups against this, 5 planning groups, the Historic Resources Board, the National Trust for Historic Preservation, the National Park Service, State Office of Historic Preservation. And what they said to us was, and all the public and had great ideas for a better way to do this, was, well, we've got the money. Yeah, and we need to accept it for the money. Even the Planning Commission said, we don't like the project, but hey, we've got the money, so we've got to do it. So that's what I meant by plutocratic interests. It was the money was driving the decision, not the merits of the project.
The City Council, which are elected representatives, they liked the project. The judge himself also said that he thought the benefits far outweighed the negatives. What did you think of that?
I thought that that was outrageous because the public said they didn't. The public was decisive. This public still is. If you look at the comments to almost any article that comes up, there's still 8 or 9 to 1 opposed to the project. And that's the way it's always been. And the public was ignored in this process.
Now, Bruce, there was talk of a compromise, mediation talks. What's the status of that right now?
I haven't heard. We're looking to Mayor Fellner's leadership on this, and we intend to make sure that the cars are out of Balboa Park.
Now, I do want to say that we tried to get San Diego City officials to come on the program. They declined. City Council President Todd Gloria did release a statement, and he said he remains committed to clearing cars out of the heart of Balboa Park and returning Plaza de Panama to the people. What's your advice to the city on this as they perhaps weigh whether or not to pursue an appeal?
I think they need to get the stakeholders together in the public and come up with a solution that we can all support, because we agree with them. And, you know, if nothing else happens, the bridge is going to be closed in a couple of months for retrofitting, so it's a good time to try that out. Also, the parking will be removed for 2015, and I don't think it'll ever come back if that's the only thing that happens. Is who's going to let it come back after 2015?
What kind of alternate plan do you conceive? Is there anything in Irwin Jacobs' plan that you liked?
Well, we liked the light posts, but really the plan was a massive, massive project to add 160 net new parking spaces, 260, excuse me, 160 of those dedicated to valet and monthly parking for $45 million to yield 100 new spaces. That was obviously the biggest boondoggle I've ever heard about.
There was a lot of enthusiasm to have this remodeling done before the centennial celebrations in 2015. Do you understand that enthusiasm?
Absolutely. We would like to see the park restored for 2015 instead of destroyed for 2015, the very thing that we're supposed to celebrate.
What do you think very quickly happens now?
We'll find a way to get the cars out. I'm confident that we'll find the way to get the parking out of the plaza and to have a great 2015. It should be a great celebration instead of the strife. You know, San Diego did not need this strife. In fact, one of the PR consultants I talked to in the end, that's what they would have told the mayor. San Diego does not need this.
Bruce Coons, thank you so much for coming on the program.
Thank you.
And in the interest of full disclosure, Irwin Jacobs is a supporter of KPBS, and while he says the project is over, City Attorney Jan Goldsmith says it may still have a chance. He tells UT San Diego City Council could amend the municipal code as an impediment to the plan, and Council could pass a project-specific exemption. The Defense Department may be poised to offer benefits to same-sex partners of U.S. troops. The Associated Press quotes sources at the Pentagon who say the benefits could include health and welfare programs and access to base commissaries. The military's ban on gay service members was repealed in 2010. Can local governments ban medical marijuana dispensaries? The state Supreme Court heard arguments on both sides today. The case could affect the future of the medical marijuana industry. Supporters say local bans violate the state's medical marijuana laws. Some justices were skeptical of the claim, one noting state law doesn't specifically require cities and counties to allow for dispensaries. Well, one day after getting sued by the federal government, Standard & Poor's is now being sued by California. The debt rating agency is accused of inflating the ratings of certain investments, leading to a multi-billion-dollar loss for the state's public pension funds and other investors. S&P has already denied wrongdoing in the federal case. A San Diego research and development company is expanding its incubator program 1 year after launching. Janssen Labs in Torrey Pines is geared specifically to life science entrepreneurs working on early-stage projects.
Now, there's a lot of illnesses that are not very well treatable by the current array of drugs on the market. And so what we do is we try to take some of those drugs and we modify them to use them for a completely different purpose with the idea of treating untreatable diseases.
Such as solving fungal disease that gets in the body and spreads everywhere. That would be a game changer for Ampex. It's one of 18 startup companies at the lab pursuing novel technologies in life sciences, from therapeutics and medical devices to diagnostics and tools.
With Janssen, we could walk in the door and start operating from day one. All the equipment we need is here, everything is maintained for us, so we don't have to focus on infrastructure. We can just focus on the science and what we need to do.
Now, the Janssen Incubator started with just 4 companies a year ago, all with the goal of delivering solutions to unmet medical needs. Many of these companies are dependent on federal funding from the National Institutes of Health and are concerned about a possible 7% cut to the program. San Diego's average gas price crossed the $4 mark this morning. The Auto Club says it's now $4.01 a gallon. But hear this, it's topped $5 in parts of Los Angeles today. And as we told you earlier, San Diego Hospice has filed for Chapter 11 bankruptcy. The move comes after a 2-year federal investigation into patient eligibility. Today, we begin our special series, When Does End of Life Begin? KPBS and iNewsSource Investigations Desk is exploring how our healthcare system treats chronic and terminal illness in our final years. Investigations producer Joanne Farian has more.
More people are choosing hospice care, and they're living longer than their 6-month prognosis, and that's become a problem for Medicare.
Curly hair.
Yes, I remember you had.
I look at those pictures and look at all this straightening. Where did those curls go?
It was pretty.
The first time Elsie Solis danced with Betty, he knew she was the girl he'd marry.
And then this was our wedding.
Now, 66 years later, Elsie and Betty Solis look back on a marriage, a lifetime really, without regret.
Can't complain about nothing. Really, if I did, I'd be a fool.
Elsie is 89 years old. He's dying. He has stage 4 heart failure. His breathing is labored. It's difficult for him to walk from one room in the house to the next. The constant pump of the oxygen machine reminds everyone in this house LC is not well.
Nice and deep.
Congestive heart failure, LC's condition, is one of the most common reasons people over 65 are hospitalized. But LC hasn't been to the emergency room in 2 years. Instead, he's chosen hospice care.
How are you doing today, LC?
Oh, pretty good, Doc. You good?
Good. I'm doing just fine.
On this day, he's being examined at home by his family doctor. He also gets regular home visits from a team of nurses and therapists. His symptoms are being palliated. That means doctors can't reverse his condition or make him better, but they can make him comfortable as his heart grows weaker.
Deep breath in and out. Again.
To be eligible for hospice, a patient must have a terminal illness and 6 months or less to live. When Medicare introduced the benefit back in the 80s, most hospice patients had cancer. Today, the most common conditions are those that make predicting death difficult. Susie Johnson is the vice president of Sharp Hospice.
A patient with a chronic medical condition, debility and decline, dementia, heart failure, end-stage kidney disease, things that are medical, pulmonary disease, Parkinson's, go on and on. Their trajectory is different. It's a slope that takes time and a lot of time. And then they begin to decline, boom, 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 like this. And then they go.
Across the country and in San Diego County, more people are choosing hospice. 10 years ago, 10,600 people were treated in hospice in San Diego County. In 2011, that grew to nearly 14,200. While the majority of people in hospice die within the first month, there are a growing number who live past 6 months. In San Diego County, 1 in 9 outlived their 6-month prognosis in 2011. And every day they're in hospice costs the government money. Under pressure to save money and find fraud, Medicare wants to know, were they really dying? San Diego Hospice, the largest in California, has been the subject of a Medicare investigation for the past 2 years. Kathleen Picurer is head of San Diego Hospice.
We've narrowed the window of patients that we take on because we're so specifically looking at it through a very strong lens of compliance.
San Diego Hospice has even discharged patients they now deem as ineligible. In other words, not terminal. Experts are asking whether it makes sense to limit care for a growing number of elderly, chronically ill patients who would benefit from it in the last year, even 2 years of life. It begs the question, when does end of life begin?
How do you take care of patients with advanced illness that may be close to end of life, but maybe not terminally, may not fit into that eligibility perfectly?
Kathleen Picurer and Susie Johnson would both like to see a change in the rules, allowing the chronically ill to have access to hospice before the final 6 months of life.
A benefit of 12 months or less, assuming the normal course of the disease. That might be more appropriate considering patients live longer with chronic illness than they did when the hospice Medicare benefit was instituted in 1982.
LC has been receiving hospice care for about 13 months.
Like I asked you once before, how long you think I got? And I know you don't know.
I will tell you the same thing I said. If I had 100 people in your situation, some would be here for many months, and some would be here just for a few days.
Yeah.
So we just got to be prepared.
LC is allowed to continue hospice care because his condition continues to get worse and his prognosis hasn't changed.
He can't go much farther with much more fluid, and his heart's going to fail. He is getting every last breath out of life that his body will give him.
And I think he's waiting to turn 90 years old the 2nd of April.
He's going to be old. I don't think I'll be here.
Well, we don't know. You've surprised us so far. We just have no idea.
I don't think I'll be here either.
Well, he doesn't know. He's guessing just like we are.
Joining me to talk more about hospice care are my two guests, both of whom you saw in the story. Susie K. Johnson is Vice President of Sharp Hospice, and Dr. Daniel Hofer is a family physician and Chief Medical Officer for Sharp's Palliative Care Program. Thank you both for being here.
Thank you.
So, Susie, why are more people choosing hospice care?
I think it's becoming mainstream. Physicians are learning how to refer to hospice, and I think patients and families are wanting it and asking for it.
And have you at Sharp experienced this increased scrutiny by Medicare with regard to who's actually eligible for the benefit?
We have, and we're doing well. We're following the guidelines and the criteria and document accordingly.
Now, Dr. Hofer, the story really tried to kind of highlight this gap that exists. As people grow older, they get sick, maybe 2 or 3 things are wrong with them. They're looking at hospice because it's a kind of care that, you experience it at home. It can help you live longer. What do you do to address this gap? If you can't put somebody in hospice care, provide this care because they're not terminal, what do you do?
Well, in the traditional healthcare model, there's not a whole lot. Patients have to have a Medicare Part A skilled need to get home health, or they simply have to move into an institution to get any level of assistance. What are called ADLs, bathing, grooming, dressing, toileting, transferring, and feeding, they're not covered by any insurance plan. The family has to pick up those costs, but that's a part of the natural decline of every illness. Now, some it happens earlier, like dementia. But it happens later. And so we don't have a good system right now to fill in that gap.
Now, Susie, Sharp has created its own benefit, really called Transitions. Tell us more about that.
The Transitions program, basically we took our knowledge of hospice care, our use of the IDT, interdisciplinary team, using prognostic indicators, etc., and we made a program for people who are in late-stage illness, heart failure, COPD, dementia. Now we've gone on to advanced stage cancer, where really we're providing a consultative service at home with a nurse and a social worker, really doing disease education and goals of care discussion and getting people prepared for what's coming next. It's not the if this happens, it's the when. We change the conversation. And that's, I think, what you saw with LC and his wife. They're really prepared for what's happening next. There aren't any surprises. That's what we've done with our palliative care program. There isn't funding for that in traditional Medicare, but in the Sharp healthcare system, where we manage our own population-based management financially and also medically, we're able to provide that service to our patients.
What really surprised me when we talk about hospice care or even transitions, that these are simple things that you're teaching patients to do at home that actually keeps them out of the hospital. You're teaching them how to take their medication, maybe increase their dose, not to retain fluid, so you take this pill instead of that pill. Correct. Is it really simple things like that, just having that home consult that can keep someone out of the hospital?
About 2/3 of readmissions, which is what the big issue is with the ACA, the Affordable Care Act, for hospitals, we found that those readmissions are based on medication mismanagement. Well, guess what? Good medication management also improves symptoms. And so by going in and helping people manage these issues, and sometimes they are very simple, we can help people do a better job. On the other hand, I cannot overvalue the importance of family moral resolution, that they understand the pathway that their parents are on. Because what happens in the traditional system is that these patients decompensate in the ER or the ICU or the hospital, and then the family shows up, the distant daughter or relative or son who hasn't been involved in their care except over the phone, asking how mom and dad are doing, and moral resolution occurs while the patient's intubated in the ICU. That's a reactive model of healthcare. And what we need to be talking to our geriatric patients and their families about is proactive management and the inevitable consequences of the best that the healthcare industry has to offer. We will do whatever you want us to do. But guess what? The patients are speaking up and saying, I just want to be at home with aggressive in-home supportive care.
We're going to have to end it there. There's a lot more about this issue on our website at kpbs.org. Dr. Daniel Hofer, Susie Johnson, both of Sharp Healthcare, thank you both for being here.
Thank you.
Thank you.
I'm Gwen Eiffel on the next News Hour. President Obama's campaign pushing gun control and immigration reform plays out well beyond Washington. That's Tuesday on the PBS News Hour.
Well, we had an overcast day in San Diego, and we'll have more of the same tomorrow, with rain moving in by the end of the week. It will also get cooler as we head toward the weekend. Mountain temperatures will drop nearly 10 degrees in the next few days. Partly cloudy in the desert, getting windy by Friday. Protea Gallery is a new addition to the North Park scene. KPBS arts reporter Beth Accomando stopped by to see the installation of their newest exhibit.
What's in a name? If you're Protea Gallery, everything.
Protea is a flower that grows in South Africa, and it thrives in Southern California, especially in San Diego County. So it's a metaphor. The flower mirrors the artist I'm going to show. It's an international and regional gallery.
The gallery is run and owned by Doris Bitar. Last week, she was helping give birth to the gallery's second exhibition.
It's like pulling a baby out with forceps, basically.
The baby belongs to artist Joyce DeLull.
Oh, it's coming right out.
And now we have to unfold it. The show is called Textscapes.
That was an easy birth.
Really has work from 3 different bodies of work that I've done, but they all involve text.
They're really not meant to be read. And the first thing you see are not words. You see a looming landscape, and there's a certain kind of romance to the pieces that prevent you from seeing the political or historical statement first.
And it is specifically an sculpture made of photographic prints that I printed on rice paper, and they're photographs of articles that were in the LA Times, starting in 2002 with the build-up to the recent Iraq War. The way it works is at the bottom are the 2002 articles, and then as it goes up to the top, it grows and it gets up to 2005. The bottom of it's going to sit on this, and that starts it, and then it comes up, and it's probably going to twist, and then the top should go here.
This is the fourth time Dalal is installing her sculpture Media Storm. The piece makes its San Diego debut as part of Techscapes.
And there are various constructions, mostly photographs, based on various texts that have to do with the Iraq War, the conflict between the Israelis and the Palestinians, Joyce's own identity as a woman of Iraqi descent and also Jewish.
I liked the idea of making something that would tower over you and actually be created out of photographs, and the text turns into like smoke because it gets so blurry.
The initial thing about Joyce's work that I absolutely love is it's not only has meaning, but it's not didactic necessarily. It captures you at a very emotional level.
Okay, so we still have some shaping to do, some patching to do.
Dalal hopes visitors to the gallery will look into the eye of her Media Storm and perhaps see the world a little differently. Beth Accomando, KPBS News.
Techscapes runs through March 9th at the Protea Gallery in North Park. Recapping tonight's top story, San Diego Hospice has filed for Chapter 11 bankruptcy protection. The hospice has been under a federal audit for 2 years and last year began cutting back on staff, facilities, and its patients. And the man who led the controversial Plaza de Panama project says it's over. Today, Irwin Jacobs told KPBS he's now just a bystander and whatever happens next to remove cars from the heart of Balboa Park. This after a judge threw out City Council's approval of the project. You can find tonight's stories and download the KPBS app, all on our website, kpbs.org/evening edition. Thanks for joining us. You have a great night.